But thank you very much for honoring our guests with your attention this evening. I think what I find astounding the most about the report is the fact that across 240 districts all across Ethiopia, 22 million children have been impacted. So for those in the audience who have similar challenges in their own countries, what would you consider to be the critical success factors that have helped Ethiopia accelerate its fight against malnutrition?
Thank you very much, Victor. I'm happy to be with you, but it's always difficult to stand between a meal and other activities. So I'm sorry to be standing here in between your dinner and the panel. But nevertheless, I'm happy to participate in this session because I have been involved for quite some time in this process. I remember with the ADB back in 2019 on the margins of the General Assembly of the United Nations. I think it's a good opportunity for us in Ethiopia to talk about the success story this program that you have is called the Sekota Declaration. Sekota is a city in the northern part of Ethiopia where this has been launched. It was launched in 2005, and it was a 15 years program to end, stunting by 2030. That was the ambition that we had. And so this is how, it's a bold commitment that the government at that time took. It has 3 phases. One is innovation, then the expansion, and the third one is scaling up the program. Each of the phases was 5 years, commitment. It has been, as you have said, implemented in 240 districts, and the result has been really amazing. The 191, I think, let me see my notes, from the 240 are the geographic areas where we work with the Big Win philanthropy. In this work that has been done, 14 sector ministries were involved in working together.
So this wasn't just the Ministry of Agriculture?
No, it's not.
It's health, it's agriculture,
it's
education.
water, it's education,
fantastic.
Women and girls, and so on. The process that led us to that, it's the high prevalence of stunting in Ethiopia. And second, also the slow rate in terms of reducing the annual average stunting reduction. And when we saw that, it was very clear that we will never meet the goal.
Madam President, I really want to jump in here because I want to ask a political question. For decades, the tendency has been that the issues of food and stunting have been relegated either to health or to agriculture. What was it that your government did to ensure that this really became a multi-sectoral approach and one that was taken very, very seriously?
This stunting issue was given to the Ministry of Health. And we have seen through years that things were not moving. It's not only, sorry, but I have to look at you. It's only at the Ministry of Health, things couldn't move. And as I said, the rate was, in fact, not reducing, if not going up. So we had to have this sectorial, multi-sectorial approach. In fact, 14 of them were involved, but not only. This is what has been done at the national level, ministries. But it has trickled down to the sub-national level, the regional level, where the regions were very much involved in this, and in fact, matching with what the national government was giving. Then we went to partners, so it's the government, national government, regional governments, and then the main funder, which is the African Development Bank, that has helped us, and this is a good opportunity for me to thank its president, my junior brother, President Adeshina, for the support that we have gotten from the bank. And this has, you know, the impact has been very dramatic, because in terms of illness and death, in terms of educational performance, obviously, and the inadequate workforce productivity. So one sector alone intervention is not enough in addressing this. So that has been very clearly shown. The other thing, this is the multi-sectoral, it's the ownership as well. At the federal level, it's under the leadership of the Deputy Prime Minister, so all concerned ministries would be involved. And at the regional level, the program was led by the regional presidents. I think the governance, the commitment, and the involvement at the highest level has helped us move. The challenge is still there, of course. It's a huge thing that we have to do, but the progress is really encouraging. That's what I can say.
Well, thank you very much, Your Excellency, very much appreciated. And in addition to the amazing work that you're doing in the area of nutrition, that's okay, in the areas of nutrition and development, I just want to throw out here, if you really want to know what Ethiopia is doing in the area of wheat, a transformation of unprecedented proportions has taken place there over the last 4 years, where they've just gone from wheat dependence to complete wheat self-sufficiency, all in the span of 4 years. I think we can give Her Excellency and the government of Ethiopia a round of applause. And I'm going to come next to the Vice President of Sierra Leone. Again, some of the challenges that we deal with across Africa are similar, but I want to focus here, Vice President Jallow, on what it is that your country is doing to improve food security in the country, and how is the plan designed to tackle malnutrition at speed and at scale? Because this is a perennial issue. We've been talking about it for ages, so we cannot adopt a business as usual approach. What is it that your new government intends to do that is fundamentally different?
Well, thank you very much. You know, we took over in 2018, and when we came, our interventions essentially around that area was informed by our experiences in terms of how the gravity of the situation. Our experiences showed when in 2018 I came, this scaling up nutrition is placed under the office of the Vice President. And there I visited several hospitals and several regions, and I realized there are huge challenges in terms of access, in terms of governance, in terms of inadequate financing. And it is based on that experience that we are able to put in place very strong interventionist actions. The first is that we realize that we have to move from the reactive logic to a preventive logic. Meaning, if we continue to spend money on therapeutic food to address malnutrition, it is not going to solve the problem. So we designed a national program called Feed Sierra Leone that we enrolled this year. That is essentially to address the overall food and nutrition security issues in the country. The objective of that program is essentially to increase domestic food production by 65% and reduce hunger by 50%. The other thing we realize is that there is need for increased financing. Because when you look at the finances that are addressed to fighting nutrition, like you just said, they are usually lost under the Ministry of Agriculture or the Ministry of Health. And if they are lost under the Ministry of Agriculture or Ministry of Health, the challenges are usually that when there are other urgent priorities like vaccines and medicines, those resources that are designed for nutrition are automatically transferred to those emergencies. So you hardly get the real financing specified for nutrition to get to the sector. So automatically what we did was to call the Minister of Finance and all the ministries for the Minister of Finance to create a dedicated budgetary line. For the first time in the history of Sierra Leone, we have a budget line that is on nutrition, specifically on nutrition. So we take that money, so we are able to use that resources on the nutrition match window. So if we give $300,000, for example, UNICEF match it with 300. So because it is not placed under a specific ministry, we can use it, so it allows us the flexibility. The other challenge we realize in terms of increasing financing, we increase the financing on that, is a governance challenge. And then we also, when I moved around the country, to assess the state of nutrition, and because I also supervise the Ministry of Health, I went to a particular hospital in a region, and I went to the maternal center, and I asked, where are the pregnant women? And they told me all the pregnant women, most of them have left to go in search of food in the neighboring towns. And then automatically it struck me that there's a very strong relationship between malnutrition and maternal health. Because if you have a malnourished pregnant woman, the tendency for that pregnant woman to even deliver safely or to deliver a healthy baby is very difficult. So during then, I also realized that another sector that was also very critical to malnutrition is the Ministry of Water and Sanitation. Because if you increase wash facilities, you are also going to increase the nutrition rate. We also came to realize that in all of this, the Ministry of Finance is also very important. So we established a multi-sectoral team in the Office of the Vice President to make sure that we don't only limit ourselves to the scaling up nutrition partners that involve national and development partners, but within government itself, I have critical ministers that pay attention to nutrition issues. We know, like you just said, the data are not favorable in Sierra Leone, also in the sub-region. In Sierra Leone today, 26%. Of children under 5 are stunted. And we have relatively a caseload of about 63,000 kids that are really in higher risk. And since 2019, when we started to roll out those interventions I just spoke about, we have seen a very slow reduction. We moved in 2019 from 29% to 26% today where we are. It is 3%. It is still very, very slow. In addition to that, we have also decided that another critical factor in all of this is information. We wanted to have the right data. We wanted to gather data. So for the first time in 2021, we roll out a national nutrition survey, so that from this survey we get data, and so that decisions that we make are going to be informed by data. We also established the multi-sectoral information gathering and data dashboard in 2023 to enable all partners, national development partners, also to report directly to this dashboard, so that we get first-hand information about what is unfolding there. But like I said, the critical factor in terms of investment I see in nutrition is not only to invest money to buy food, like therapeutic food, or to improve nutrition clinics that we have established right across the country, but also there is a need to invest as well in the policy and governance line. What does that mean? It means sometimes we make a lot of commitment. Like for example, in Sierra Leone, we have 10 nutrition for growth commitment. 2, it's on stunting. The other remaining 8 is on governance and financing. So, but the focus, our experience in Sierra Leone have shown that even the governance architecture, how it functions, how it responds to addressing nutrition is critical. Because you can have fantastic commitment, but they cannot be translated into tangible results on the ground if you also don't invest in how you approach, in the methodology, how you approach this, by bringing all the critical ministries. So that is what we have been doing so far. And like I said, our focus is to be on the preventive mode. Increase food production so that at least we are able to tackle it hands-on. but there are still challenges.
Thank you very much, Vice President. Absolutely, innovation is key, policies are key, but implementation is much more important. As Dr. Additional likes to say, stomachs were designed to be fed. But we do know that the issue of malnutrition is a perennial one. And it's one that we have to face boldly, strategically, and differently over the years to come, given the huge population expansion that we're expecting over the next 30 years. My charge, at least as the moderator of this session, is that as we as leaders continue to put resources into huge infrastructure, whether it be hard infrastructure, let us be mindful that the soft infrastructure of the belly of a child is much more critical. Your Excellencies, I want to use this opportunity, President Sally Works-Ready and President Jallo, Vice President Jallo, I want to say a big thank you and huge encouragement all the way for all that you're doing in Sierra Leone and Ethiopia. You deserve a round of applause from our guests here today. But just before you go, your nutrition programs are targeted at what age group, what demographic?
Well, the survey that we conducted so far, the focus, like I told you, within the Feed Sierra Leone program, is to increase food production.
What's the age demographic?
The age demographic for nutrition.
Yes.
The under 5. We have
under 5.
We tackle the under 5 and then also young girls between 5 and 11 years old.
Okay, thank you very much.
The interesting point I wanted to make is just like when the president of the ADB was talking.
I know I opened a Pandora box here, but I just wanted to get
the point is that there's a very strong relationship, the data in Sierra Leone have shown, between nutrition and infant and maternal health.
Absolutely.
It's very important. It's not only the cognitive part, because the data we receive shows that the leading factor of infant health before 5 is malnutrition.
Absolutely, absolutely. And President Sade, what's the age demographic that you're targeting in Ethiopia?
The focus is on children under 2.
Children under 2,
yes.
Okay.
Yes, because 1,000 days are critical.
Absolutely, absolutely. Once again, congratulations and thank you very much for joining us on this panel today.